they provide that excellent customer experience.
Fantastic. Thank you so much for sharing that. I feel like we should almost have Sheila join us on the stage, but by the way, if you go to Kiarie nowadays and interact with them, I'm sure you guys can tell a huge difference from 10 years ago, right? And I think it's thanks to people like her. So Gaba is on the CX program, for sure, for sure. So Monica, how are you?
I'm fine, thank you,
Yeah,
Moses.
karibu sana.
Asante.
So how are you guys at Aga Khan, of course, and of course I know you in a previous life at another healthcare organization. How are you integrating customer experience into the healthcare to improve patient outcomes and also satisfaction at Aga Khan University Hospital? And also, what are some of the CX strategies you've implemented to drive operational excellence?
So thank you so much, Moses. And I'd also want to thank Ranaf and the entire Rihanna group for organizing this event. I think we need to keep having more of these interactive events. So when you think about healthcare, it's a little bit of a different space. And by the way, in healthcare, we don't talk of the customer experience, we talk of the patient experience. And when you're coming to a hospital, it's not your best moment, you're actually suffering, isn't it? Yeah, so when you're coming to the hospital, when we're looking at patient experience, what do we want to do for you? We want to reduce the amount of suffering associated with receiving care. Isn't that the case? Yeah, so what are the pain points when it comes to healthcare? Wait times. I'm sure you can all testify. How many have waited 5 hours? Yeah, so wait times, that's really a pain point for us at the hospitals. The other thing is optimizing our communication channels. So you'll find the front office person is the same person serving a patient in front of them, and the phone is ringing, you're trying to book an appointment. So is this a person supposed to pick the phone, or are they supposed to serve the person in front of them? So those optimizing our communication channels so that we make it easy for you to book, access, and get the information that you require. So that's another thing. And then the other thing is transitions in care. In the healthcare industry, it's really complicated because we have very many players. By the time you're getting to see the doctor, you've passed through so many hands. Yeah. So that's the whole spectrum that we're looking at. So in Aga Khan, to be specific to your question, we've done a lot of things, which I'm going to share with you today. But one thing I'm going to tell you is that there's no magic bullet when it comes to patient experience. It's a lot of like Mitch said, you have to be agile. You know, there's a lot of iteration. You try something, you know, you have this brilliant idea, you think it will really change and move the needle. It doesn't. So you have to be resilient and really keep trying. So I would actually summarize and say in Aga Khan, we focused on 3 areas. So the first area is people. The second area is our processes, and the third area is technology. That's where Rihanna Group comes in. So when I talk of the people, I think Mitch alluded to that in your presentation, leadership endorsement. That's very, very critical. If the leadership is not supporting CX, patient experience, if they're not resourcing it, if they're not passionate about it, then it's very hard to create that culture. So at the Aga Khan, I would really say that our CEO has been Mr. Rashid Kalani. He's been very passionate about that. And that, when it starts from the top, then it does trickle down. Then the other thing when it comes to people, we are the leaders. Most of us are the leaders sitting in this room, but we are not the ones giving the patient experience. It's the people who are under us, yeah? So as leaders, if we are not taking care of the people who are actually giving this service, yeah, then no matter, even if we go to the rooftop and shout about patient experience, it'll never come to life. So for us as leaders, I would say take care of the people who are taking care of your patients. Yeah, are your people well-resourced? Are they well taken care of? Are they supported in their work life? Of course, we do the trainings, but also making sure that your employees are well looked after. As someone who's joyful, have you ever been served by someone joyful? It just rubs in on you, isn't it? Yeah, so take care of your staff. So when we come to our processes, hospital processes are complex, like It's not very easy. But so one of the things that we look at, and I think we are famous for, is of course our accreditations, JCIA. For a hospital to run, you need to standardize your processes. So that's the first thing, and that's why we do all these accreditations that we do. The second thing, when it comes to wait times come because of what? Because of the bottlenecks, isn't it? Because people are coming at the same time, lots of people, you have to serve all of them. So we have to look for ways to decongest these numbers. So we do this through our outreach centers. We have 53 outreach centers, and that's how we manage to decongest other patients. The other thing that we do in terms of decongesting is telemedicine. Mitch again talked about the pandemic era. We had to innovate. There's a time when you wouldn't do a Zoom call with the doctor, but nowadays it's a common thing. So we do telemedicine. We do, if you want medications delivered to your home, why not? Why do you have to go and queue in a pharmacy for 2 hours? We do that. If you just need a simple blood, like there's a 2-week thyroid test for newborn babies. Why do you have to carry your newborn baby 2 weeks to queue for 2 hours in the hospital? Just call us and we come and bring a phlebotomist to your house and we draw the samples. So those are some of the innovative solutions around what we've been doing. And then last but not least, speaking to Rihanna Group, these guys have been our core partners. We have QCs in our hospital, and it's been working wondrously. So it's helped us really manage the queues and create predictability. Then the feedback system, I don't know about you guys, but we used to do manual feedback before. Where you tell them you have to give us 20% feedback, and people would sit and write. The bad feedback would never come to us. But now with the QR codes and patients have to scan the feedback, we are getting authentic feedback. We thought we were the best, and all that. We used to score 99%. But once we got the QR codes, we are getting authentic feedback. We are hearing the raw feedback from patients, and we are able to pivot.
Well, thank you so much, Monica. And I think many of us who are your customers, or is it your patients, over the years, I think we can see that it's like night and day. From, as you said, from driving in to